So again, thank you everyone for coming, and always Tina is the best. She's right down the street on Oak Park Avenue. Thank you for doing this. Yeah. We wish we could answer the questions, but we can't. That's why we invite the experts. And as always, sure Tina will take very good care of you and do a great job. And we are recording this, so if you miss something, don't worry about it. It'll be this camera or this camera, one of them will be recording. And so we'll put it on YouTube, so if you miss something, don't worry about missing it or writing something down. You can go back and watch it. He'll live stream it now, and then you can also go home then and watch it on YouTube tonight. Just go on Tinley Park Television, and then you'll see it on there, and then you can rewatch it if you missed something and have any questions. And then obviously Tina will give out her information, so you can contact her.
Thank you.
Cool. Thanks, Tina, for coming.
You're
We'll
welcome.
stand
Thank you so
back
much.
out of the way. Hope everyone learned something.
Thank you again. Thank you everyone for coming. My name is Tina Koneski with TK Insurance Services. I am the owner of TK Insurance Services. I'm a local insurance broker. I'm right down the street on 165th and Oak Park Avenue, just like Mayor Glotz had said. And I'm here for you. So today what we're going to talk about Medicare 101 and hopefully make it easy. Who in here thinks Medicare is a little challenging, difficult, confusing, right? Absolutely. So it doesn't have to be, right? So that's what I'm here for, to help you break it down, make it easy, help you to navigate the Medicare process. We're also going to talk about tonight a lot of the changes. We've seen between last year and this year, we've seen more changes than we've seen in the last 2 decades. So you think that's important to understand all those changes? Absolutely, because it's going to directly impact you whether you're on Medicare now or you'll be going on it in the future, okay? So a couple housekeeping rules. If you have a phone, please put it on silent, and I'm going to go ahead and make sure mine's on silent as well. There's the bathrooms are right outside the door, so we're all adults here, so if you need to use the bathroom, please just go ahead and crouch around and go on to the bathroom, all right? So we're going to take about an hour. So many of you, I'm sure, have a lot of questions. I hope to answer most of your questions through my presentation. But if you have a question, I'd be happy to answer it. Try to hold them off till the end. If there's something that is regarding a personal issue, I'm going to ask you to hold that off till afterwards, and we'll sidebar that because we don't want to affect anything with HIPAA violation with any personal stuff. But if it has to do with a group setting or just general, I'd be happy to answer that. If I don't know something, absolutely, I'll get that information and I'll get that to you, okay? So again, Tina Koneski, TK Insurance Services, and I'm here to help you navigate through this process. I'm non-biased. I'm an advisor on the ground. I'm local, so you're not calling somebody that's out of state or anywhere else. Every year I help my clients do reviews because things change every single year, okay? One important thing to note is I sit down with clients, I help them and counsel with them, and I don't charge for my services, all right? So it's really important to understand that, that it's all at no cost to you, all right? So I just want to let you know a little bit about me. I've lived in Tinley Park for over 31 years, so I'm really vested in the community. I love volunteering. I've done a lot of volunteering throughout the community, throughout the years, even with the schools with my children, in different sports events and so forth, and very involved in our church. And also, I'm an ambassador and on the board, as I said, with the Tinley Park Chamber. So we do a lot of events. The ambassadors, we have a lot of fun. We're always out there and meeting different people at different businesses. That was why I asked you guys about your business. We love to welcome you. And it's about a community, networking together and just helping each other in our businesses. All right. So again, today we're going to talk about the ABCs of Medicare. You know, what is Medicare? It's health insurance from the federal government. It's not private. We're going to talk about where do you enroll, when do you enroll, how much does it cost, and how it changes every year. We're going to talk a little bit about how the Inflation Reduction Act has truly impacted how you receive a lot of things. And we're going to talk a little bit about what is a Medicare supplement, what is Medicare Advantage. We're going to talk about a prescription drug coverage. You have options. A lot of people think they only have one option. You have a variety of different options, and we're going to tackle a lot of those questions as we go forward. Does anybody know when Medicare first started? What year? Very close, right? No, January 7th in 1965, and it consists of Part A and Part B, your hospital services and your doctor services, and it really hasn't changed much since then, all right? And that's the federal government, right? So when we're looking at that, a lot of people are used to when you have your insurance, you have group insurance, right? Family insurance, whether it's on the under 65 or while you're working. When you get to the Medicare age and you go on Medicare, everything is individualized. So every person is individualized when they're looking at their health care, right? So I have clients that come in, husband and wife, and sometimes they're on 2 different types of plans. They may be on 2 different companies because everybody has different needs. And that's what I look, when I sit down with an individual, I'm looking at what is your need specifically. Everything is specific to you, okay? So it's really important to understand that. Does anybody know where you sign up for Medicare? Where do you go when you're getting ready to go on Medicare? Social Security, absolutely. So it's either Social Security Administration or your Railroad Administration, right? Railroad Retirement Board. So a lot of people, there's so much misinformation out there, a lot of miscommunication. I hear all the time, oh, you know, I have to sign up or I don't have to sign up, and people get really confused on that. And so with Social Security, it's the Social Security, not the Medicare site. Social Security is the one where you sign up and where they create your Medicare number, okay? So one of the questions that I have is, when you sign up for Medicare, do you also have to collect your Social Security, since it's at the Social Security office? No, you don't, right? So yes, they're both at the Social Security office, but 2 different entities, all right? You do not have to collect it at the same time. So you have the 7-month window when you're first eligible, 3 months before your birthday, month of your birthday, and 3 months after. So if you have that 7-month window, when's the best time for you to sign up if you were to go on Medicare? Do you know? The 3 months before, correct, right? And if your birthday, let's say, is on the 25th of December, when would your Medicare start if you did it before that? December 1st. It's always on the 1st of the month of your birthday. What happens if your birthday's on the 1st? When was your Medicare start? The 1st of the month prior. Oh, you guys are good. You want to come over here and teach us? No, absolutely. So you have, that's called your initial election period. So if you're still, so when you turn 65, do you have to take your Medicare? What about Part A? You do? It's automatic? The answer is no. You do not have to take your Part A. That is one misconception, right? So I'll give you an example. Government says that if you're working and you have credible coverage as good as Medicare, and let's say you have a high deductible plan and you're paying into an HSA, the government says you cannot contribute to an HSA when you are when you have your Part A. So you can potentially have some tax penalties. So you want to make sure about that, right? You want to make sure, should you sign up, when you sign up, and so forth. So that's really important to know. Once you get those penalties, it's like, you know, you don't want to wait till that, right? You want to make sure you have the knowledge of when to sign up, okay? So no, you do not have to sign up for Part A. Yes?
But isn't private insurance subservient to Medicare?
No. Great question, because a lot of people believe that. If you have credible coverage as good as Medicare, and Medicare dictates what is credible coverage, usually a company has credible coverage if they have more than 20 employees, that is your insurance. As long as they continue to cover you, you do not need to sign up for Medicare at all. So if you're working with credible coverage, you can stay on your group insurance. You do not have to take your Medicare, okay?
But you still have to sign up.
No, the answer is no, you don't.
Really?
No, you do not.
I thought you had to. I
No,
thought if you-
no, that's a
if you
misconception.
system
That
at
isn't,
65, that
no.
you'd be penalized later or
No, it's a
something?
misconception. You do not. And again, that's why I just gave you one of the reasons why it's not mandatory, because if you're contributing to an HSA, which is a wonderful thing, right? It's pre-tax dollars. Who doesn't like that? And sometimes your companies will help contribute to that. That's free money, correct? And you want to take advantage of that while you're working, right? So if you can no longer contribute to that if you pick up your Part A. So I always tell my clients, until you know when you're ready to retire, wait. all right? Because you may not have it this year, but you might have it next year. You don't know what the company is going to do and what kind of plan the company is going to take on, because it's always in their best interest, am I right? Yeah, so you don't know if you're going to have an HSA. So the answer is absolutely not, right? So you do not have to sign up for your Part A. If it's a credible coverage as good as Medicare, which is typically if the company has more than 20 employees. And I would always revert you back to your HR department to make sure it's credible coverage as good as Medicare. Absolutely. Typically, it's not then, and then you do have to pick up your Medicare. Yes.
There's a form you have to send to Social Security, correct, if you are gonna use your employer's insurance, right?
No,
How do they?
not at that time.
Okay.
So then there's what's called a special enrollment. So let's say you delay your Medicare and you're gonna work until 66, 67, or as far as you want to. Well, then you would roll into what's called a special enrollment period at that point, all right? And the special enrollment period, then you have 2 months to go on to a Medicare and then to a plan before you end up getting a penalty. So,
I'm on Social Security already, I took it early, so that's why my situation's a little different.
okay, so if you're collecting Social Security will automatically enroll you into Medicare. If you are still working, then you'll want to turn that card back in and say, I want to delay my Part B, because at that point, you cannot not take your Part A, because they automatically enroll you. But you will send your card back, signing that, saying, I want to postpone my Part D until I'm ready to retire. And that would give you a special enrollment period. You have 2 months to get into a plan. So you want to know ahead of time, so you're making sure there's no gap in insurance. And yes, that's when the 2 forms will apply. There's an L564 form and a 40B form. Both those forms you'll have filled out, take to Social Security saying, I'm ready for Medicare now, and your employer is giving proof of coverage that you've had credible coverage that entire time. Those are the forms I believe you're alluding to.
So you're saying 2 months for the special enrollment period, is that prior to retiring?
So I'm saying you have 2 months to get onto a plan before you receive a penalty, especially your Part D, right? You have 8 months for your
Okay,
Part
so
B.
in other words, when you do eventually sign up, that's where you're talking.
I would always tell you to know your date 2 months prior, start that process of getting the paperwork into Social Security so that you can have your Medicare Part B starting on the day of the first of the month that you're losing your credible coverage, and what other plan, because there's a lot of holes in Medicare, that you want to enroll in so that you are ready to go on the first of the month of losing your credible coverage. Make sense? All right. All right, so yeah, so if you're collecting Social Security, they will automatically enroll you, okay? So what about some stay-at-home moms or dads that did not work, right? So we're gonna talk about some of is Medicare free? Let's ask that question. Is it?
Well, it's not when you would pay into it.
100%, right? A lot of people say it's been free, but as long as you've been working the FICA on your check, you've been paying into it this entire time. So I never say it's free, and even when you take your Medicare, if you keep working, you're paying into it. But if you worked at least 10 years, 40 quarter hours, then there is no cost for your Part A. Everybody pays for Part B, and that's important to understand, right? Because when you're looking at the premiums, every year that goes up with inflation, we do not have the numbers for 2026, but in 2025, that number was $185 if you were in the national average. Now, if you're a high income earner, then that cost is going to go up. There's something called IRMA, and I can tell you she's not your friend, right? So the more you make, the more your premium will go up on Part B. And also your Part D as well will increase. The cost of that will be added. I'm sorry?
Where's the cutoff on that, where it starts increasing?
For 2025, every year that changes. So for an individual, it's $106,000. If for a married couple filing jointly, which also makes a difference, it was $212,000. But again, those numbers change every year, right? And it's not just your income. They look back 2 years, right? So let's say you got a windfall, you got an inheritance, or you sold some property, or let's say, you took some of your 401k. All that is known as earned income, correct? That all counts, so you want to look at that. You can always do a redetermination once they assess you, but you need to know that, right? You might think, oh, it's $185. It may not be for you. It all depends on what you're making, all right? So that's really important to know. All right, so what is Part A and Part B? Part A is your your hospital services, so your inpatient hospital facility services, so your inpatient hospital, your skilled nursing, and so forth. Part B is all of your outpatient, the doctors that take care of you in the hospital and all your outpatient services, okay? Your preventative services, your diagnostic tests, your MRIs, your CT scans, therapies, durable medical equipment, all your Part B drugs, Part B tests, and that's going to be important to understand that in a little bit when I talk a little bit more about that. So Medicare it doesn't cover everything, right? It doesn't cover your first 3 pints of blood. It doesn't cover you going to a rehab if you're not in the hospital more than 3 overnights. It doesn't cover annual physical. So there's a lot of things Medicare doesn't cover. Medicare doesn't cover prescription drug plans. So you got to make sure you have the proper coverage when it comes to that, okay? And there's deductibles and coinsurance that come along with Part A and Part B. So there's deductibles and coinsurance on Part A. There's a deductible, a premium, and a coinsurance on Part B. Does Medicare approve everything? No. So there are prior authorizations, and you're going to see that more and more, okay? Especially this last year and the years to come, you're going to see even more of that. So we're going to talk a little bit more, too, about what are Medicare supplements, Medicare Advantage plans. We'll talk about a lot of those other drug plans and so forth. So that's what I do. I help Medicare beneficiaries specialize in navigating that process. So I specialize in Medicare Advantage plans, prescription drug plans, Medicare supplement insurance, dual eligible plans, which is something new this year. We're going to talk more about that. I help educate beneficiaries, and I help them through the different enrollment periods throughout the year, right? You have special enrollment periods, you have general enrollment periods, you have open enrollment periods, annual enrollment periods. So there's a variety of different times throughout the year, depending on your circumstance, when you're eligible to enroll, okay? I help support my clients by comparing plan types, because there's a variety of plans out there, evaluating provider networks and coordinating transitions or enrollments between coverage options. I also provide the one-on-one guidance during open enrollment and special enrollment. So I'm local, I'm non-biased, I don't work for Medicare, and I don't work for any of the companies I represent. I work for my clients. I work for you, right, and help you in that process, all right? Say again?
How do you get paid?
By the minute. No, I'm joking. No, I don't charge for my services. When I help someone enroll into a plan, I'm direct to all the companies I represent, and I get paid by the companies. So when I help you enroll into a plan, okay? All right, so I want you really to understand some of the different types of concepts of coverages out there. So we already talked about original Medicare, your Part A and Part B, and that was a federal government. Medicare and Medicaid, that was a program. So Medicare was the government, Medicaid is by the state, and it was managed separately all the way up through the end of this year. That is going to change next year. Then there was the Medicare Advantage plans. Medicare Advantage plans is the alternative to original Medicare, so it's your bundle package. It really works a lot like how the group insurance and the under 65 works. Then you have Medigap, right, that's supplement. That helps fill the gaps in original Medicare. I really call it insurance for your pocket, because it's going to help with some of the out-of-pocket expense that you have with original Medicare, all right? And then there's what's called DSNP, Dual Special Needs Plans, and that had some coordination of benefits for the dual population, the lower income, the Medicaid population. And then there was something called MMAI, and that was a fully integrated dual eligible plan. So those are a variety of different types of coverages, and we'll talk a little bit more about each one of them, all right? Because there's going to be a lot of changes. There's some transition timelines for Illinois for beneficiaries. So in December 31st of 2025, the state Medicaid program called MMAI will end. So if you know somebody that is on the state program of MMAI, let them know that, you know, they can call me or call another broker or somebody and get some information, because they will lose their coverage, all right? And then in January 1st of 2026, the fully integrated dual special needs plans will become effective. So it'll be a fully integrated, it's no longer where Medicare will be taking care of something and Medicaid will be taking another part of it. It's all working together, all right? In January 1st of 2027, anyone who is on state Medicaid getting the long-term support and care services, that will end according to the way it's being admitted now. The only way somebody will get those services if they are on one of the dual special needs plans. Many carriers put a bid into Medicare for it. Only 4 carriers won the bid, and each carrier has 1 plan each. So there's only 4 carriers, 4 plans that these people have to pick from. So that's really important to understand that. MMAI beneficiaries, they'll be transitioned into one of these. It's called a FIDE, Fully Integrated Dual Eligible Special Needs Plan, with enrollment materials will be sent out in advance, and then there'll be a continuity of care measures are expected by the state. They'll be sending out this information, so people will be aware of it, and hopefully they'll get transitioned into a plan where they won't lose any coverage. So what beneficiaries can expect in 2026, as I just said, the transition of the MMAI to the FIDE plan. They'll get new ID cards, updated summary of benefits, provider directories, possible changes in care, depending on the plan choice, right, from those 4 carriers. Existing members may be auto-enrolled or into an affiliated FIDE plan to maintain the continuity. Enrollment support and plan comparison resources will be provided to assist in this transition. All right, so what is a FIDE plan? Yes. So this is Illinois. So there was a dual special needs plan in Illinois that went away several years ago. It's coming back this year. So we had them back before 2017 in Illinois, and they have maintained in several other states in the country, but we have not had one here in almost a decade. So now it is coming back. Again, the MMAI was kind of a broken system, you know, and Medicare would pay one portion and the state would pay another portion, and they couldn't balance bill. It was illegal to the beneficiaries, and sometimes doctors got paid, sometimes they didn't, and sometimes doctors didn't want to accept that Medicaid program. So now with the FIDE program, it'll be a fully integrated dual eligible special needs plan. They'll be able to know, are they eligible right from the beginning, right? There's going to be several levels of Medicaid, and only 3 levels will be able to go into this plan. But they'll have access to know who are eligible for these plans. So it combines all Medicare and Medicaid benefits into a single Medicare care plan. So you have your hospital, you'll have your doctors, your prescription drug coverage, your Medicaid benefits, including behavioral health, and also the long-term care services that come with Medicaid will all be a part of that plan. So it'll be a unified care coordination, and they'll have case management to help them in that process. And it's just all aligned with the provider network. They're all working together, all right? So that's important to know. All right, so let's talk a little bit about Medicare supplements. Medicare supplements, as I said, I call it insurance for your pocket. It is private insurance companies, and in 1992, they were standardized by the federal government, all right? So what does that mean? Plan G is Plan G is Plan G, or Plan N is Plan N is Plan N. We know that Plan F and Plan C had gone away for any new Medicare beneficiaries back in 2020. Maybe you had parents that might have been on those kind of plans, but those are no longer eligible for new Medicare beneficiaries. Just because they are standardized, and standardized just means that if Medicare approves a procedure or a test or a surgery or or whatever it's going to be, by law, the supplement, whoever it is, whatever company, they must cover the 20% after you pay your deductibles, all right? Now, there's deductibles on these supplements where prior to 2020, there was plans that had no deductibles. They covered all of your out-of-pocket expense when it comes to Part A and Part B. So we have seen, not only this year, but last year as well, and you're gonna see it for the next 2 to 3 years, higher than normal rate increases, all right? So when you end up enrolling in Medicare to help cover that gap, you have a 6-month window, 6 months when you first get your Part B, that there is no medical underwriting whatsoever. So you're allowed to get whatever company at the best price, right? What that company is offering you. So it doesn't matter about pre-existing conditions. There is no underwriting. After that 6-month window, they have the right to take a look at your history. They have the right to rate you or decline you. So it's important when you're looking at supplements, you're looking at one of the most important things about it, and it's not about the price. And that all too often is what people look at, is the price. It really is about stability of the plan. That is what matters most when you're looking at a supplement, all right? So why are we seeing these increases? That's important to understand. So through that Inflation Reduction Act that got passed in 2022, there was a lot of biosimilar drugs and testing that were approved, which are the supplements are helping cover the Part B costs, correct? That 20%. So all of your Part B drugs fall under that umbrella. All those new testings fall under the umbrella. So they're covering that cost, making it a lot more liability for them to cover. More people are taking Part B drugs. So that's huge, especially with the increase of the prescription drugs, your Part D. So you're seeing more and more people on the Part B drugs. There's more GI, more guaranteed issue business than normal, all right? Many of these companies, because of the rising cost of inflation and the increases of these Medicare supplements, you got to remember, they're not getting the funding from the federal government like the drug plans and the Advantage plans are getting. So these are higher increases on these. And when a company can no longer sustain it and they leave the business and they're no longer a part of the business, right? And there are companies that are leaving and no longer they're staying with the ancillary products, but no longer with supplements. What does that do? That allows everybody on that particular supplement to have a guaranteed issue to go somewhere else. So now you have all these other companies, because they have guaranteed issue, are receiving these Medicare beneficiaries with some adverse effects, right? Which with all the liabilities, they're sicker, they're older, they're having more testing, more surgeries, and more circumstances, right? Which are rising those costs as well. This is also a COVID reset, right? We saw this last year. We saw it. We're seeing it again this year. We can expect it next year. So during COVID, during that 2020 to 2024 era, a lot of people did not go to the doctor. Many surgeries and procedures were delayed. And so we saw in this last year and in this year, more and more people went and got those procedures and knee replacements, hip replacements, and what have you. And we saw a lot of circumstances come out of COVID, right? Which we saw a lot more illnesses and so forth. So a lot more costs to these carriers. And so they're raising those prices because of that. Also, there's something known as the birthday rule in Illinois, and not all states have a birthday rule. So if you have some of these people that were in that Plan F, for instance, and there's no new Medicare beneficiaries going into Plan F, right? In order to sustain that book of business, what do you think is happening to the price? It's increasing, correct? To sustain the book of business. Well, in Illinois, with our birthday rule, you're able to go down to a G, or you're able to, if you have a G, you're able to go down to an N. You have guaranteed issue to do that during the month of your birthday because of the birthday rule. And again, not all states have that. Or let's say you move and that supplement is not offered in your new state, wherever you move. You have, again, a guaranteed issue to go into a book of business at the lowest cost. So rate stable is one of the most important things. So when you're looking also at a Medicare supplement, you want to look at what is the medical loss ratio. That's important to understand, right? If it's got a huge medical loss ratio, that's going to raise the price. Do they shelf books of business? Many companies do that. Some of these companies are very notorious for it. So they get a book of people, a group of people into this book of business, and then they close it off. No new healthy Medicare beneficiaries can come into that book. So you have this book of business, and as these people get older, right, sometimes our health tends to fail. Our liabilities increase. What happens again to that premium? It goes up. Now, if they close that block of business, they're not saying they're doing away with it. Those people are stuck. Because if they have ailments, they cannot go to another supplement because they will not medically qualify for it. So they're stuck. Now, if they totally close the book of business, then those people have a guaranteed issue to go into another plan. Does that make sense? All right. So you want to know, do they shelve their book of business, and how often do they do it? Some do it every 2 years, 3 years. So you want to know about that, right? And how many people are insured on that plan? The larger group of people, the more the liability is spread, right? So your price will stay a lot more stable. So a book of business must be profitable on its own. So some companies, there was a life insurance company years ago that was a huge company, and they wanted to be known as the biggest dividend company out there. So they would take their profits from their dividends and they put it onto life insurance. It ended up failing because of that. So even though they have supplements, they might do ancillaries, they might do Advantage, they might do, drug plans, whatever, they have to individualize, be profitable on their own in order to be sustainable, okay? And again, as I said, more and more carriers are exiting the Medicare supplement field. All right, so let's talk a little bit about Medicare Advantage plans. What are they? So they are the alternative to original Medicare. So it really is, it replicates a lot how your group insurance works. It replicates how the under 65 works. So it's a bundle package. So do you still keep your Medicare if you go on an Advantage plan? Because I hear people all the time say, oh, you gave up your Medicare. Did you? No, you don't. You still got to pay that Part B, correct? So you did not give up your Medicare. Your Medicare is a part of that plan. You must have your Part A and Part B, and then you have your bundle package. They are all network-based. They're private insurance companies. And so you have your Part A, your Part B, you have your prescription drug on most of them, not all. There are some that are really geared towards the veterans and so forth, or someone who gets their credible coverage for prescription drugs somewhere else, right? Whether it's a retiree group plan or something like that. So Medicare Advantage plans as well, they must be profitable on their own as well. And we're seeing a huge disruption with them as well. So every Medicare Advantage plan on the market must be approved by Medicare, all right? They submit their bids around April, May, and then Medicare has to approve it. If Medicare doesn't approve it, they send it back and they have to reevaluate. This year, has been an upset, right? So a lot of things were redefined with Medicare. Medicare added more regulations and more rules and things that they weren't sustainable. So several Medicare Advantage plans left the market. Many plans that weren't profitable, they are no longer going to be in existence as of 2026. So because of some of the rules that Medicare put on these Advantage plans, it's causing a lot more money for administrative costs. And healthcare costs. For example, a lot of carriers have to verify with the doctors for certain health conditions. It used to be they can just look at the MIB or they just look at the prescription drugs, and we're able to verify through the prescription drugs on the different chronic conditions and so forth. But now it's costing a lot administratively to go after and call in these doctors and doing that to verify, okay? So also in that Inflation Reduction Act, they shifted a lot of the cost of the prescription drug cost to the carriers. Who remembers a donut hole? Anybody? All right. So there used to be 4 phases, and one of them was a donut hole. In the donut hole, the manufacturers help cover 70% of the cost of that drug until you hit your catastrophic, and Medicare helped cover 80% of the cost of that drug through the rest of the year. Well, now Medicare is only covering 20%, and the manufacturer in that catastrophic is only covered in 20%. The carriers are taking on a lot more of that cost. Many of the carriers are hurting because of that cost with the negotiations of some of the higher cost drugs and so forth, right? So it's really hurting the carriers, and a lot of funding's been cut. So you're seeing higher deductibles, you're seeing companies reducing their drug formulary. So all Medicare Advantage plans that have a drug plan on there, they have, you know, prior authorizations, they have on the drug portion. So there might be quantity limits, there may be step therapy. And we're seeing more and more of those, even on the Advantage plans happen. And a lot of the drugs are being reduced on certain plans because of the high cost, okay? And then even with all the rules that Medicare put in place, they're not cut and dry. There's tons of confusion, a lot of interpretation on a lot of these companies and a lot of the plans. So very, very confusing. You guys think you're confused? That bill was really confusing. So even carriers were confused on it. So many of the carriers are pulling out of Medicare Advantage plans due to them being in the red. And so when I said that they have to be approved by the federal government and they get funding, every plan is rated on 0 to 5 star. The higher the performance, the more funding from the federal government. As they receive the funding from the federal government, 85% of every dollar has to be put on the medical portion of the plan. So there's a lot of administrative costs now. So that costs them a lot of money, right? They have the drug plan, they have the ancillary products, they have a lot of other things that's on these plans. So it's really, a lot of them have gone into the red. So you're gonna see a lot of the Medicare Advantage plans exiting exiting in 2026, all right? And then that takes us to our prescription drug plan. That's known as Part D, all right? So these are also private insurance companies, also have to submit to Medicare and be approved by Medicare. There are 3 phases of every plan. There's a deductible stage, an initial stage, and a catastrophic stage. There's step therapy, prior authorization, quantity limits. So what if you were going on Medicare and you don't take any drugs? Do you have to get a drug plan? Do you think you need a drug plan if you don't take any drugs, right? You think so? Absolutely. Even if you don't take drugs, if you don't get a drug plan when you're first eligible, there is a 1% late penalty. So you want to make sure that you end up getting that drug plan. Yes? So great question. The VA. The VA is credible coverage for prescription drugs. Is the VA credible coverage for Part A and Part B, though? I have a lot of veterans. Many did not know that. It is not credible coverage. So you do have to get your Part A and Part B if you're looking to go to something outside of the VA. The VA does not coordinate care. So God forbid, you went to a hospital or you wanted to get a second opinion or you wanted to see a local doctor, you need your Medicare. So you need your Part A and your Part B. Many of my veterans also pick up a prescription drug because the only way you can get it from the VA, your prescription drugs, is if somebody at the VA wrote that prescription, correct? Yeah. So that's important to understand that. So we're seeing.
So do I need for Part D then?
Uh-huh.
Do I need to still sign up then for Part D?
If you have credible coverage, you do not have to, correct? So.
So the VA is not considered credible?
No, the VA is credible coverage for Part D for prescription drugs.
Oh.
It is not credible coverage for Part B, which is your doctor services. All I was saying is in order to get your prescription drugs through another doctor outside the VA, you would need prescription drug coverage in order to get it, like at Walgreens or wherever, from a local cardiologist, pulmonologist, whatever. Does that make sense? Okay. Or if you're traveling and, outside the area. Okay? All right. So as I say, you're seeing a lot of increases. We saw huge increases as well. You know, not only, you know, we saw the double-digit increases on the supplements. We saw between 16 and 40% on the supplements, and when we saw huge increases on drug plans, we saw many of them go triple digits. So it's really important that when you're looking at a drug plan, whether it's a standalone drug plan or it's embedded into an Advantage plan, the biggest thing you want to make sure is your prescription drugs is covered on that particular plan. If that drug is not covered on your plan, how much are you paying for that drug? Anybody know? All of it, 100%, right? So the only way that it will go towards that plan is if it's covered on the formulary. So that's really important to understand. So you have your deductible, your initial, and your max out of pocket. The numbers for 2026, the max out of pocket is $2,100, and the deductible, a plan can charge up to $615. Most plans have those deductibles on tier 4, 5, and 6, and many of them have it on tier 3 as well. So you have your 5 or 6 stages, right? You got your preferred generic, your regular generic, your preferred brand, your non-preferred brand, and your specialty drugs. Every one of them are assessed according to that particular plan, a set copay or a co-insurance. In the three phases, you have your deductible first. So if you have a drug in tier 3, 4, 5, or 6 that has a deductible, you're paying the full cost of that drug until you reach the deductible, and then you're paying that copay. Many of the drug plans now, this year, and you'll see more we've seen for next year, will go from a set copayment to a co-insurance, right? Big difference. Having a set copay of, you know, $45 versus 25% of the cost of a drug, including a deductible. That can get quite costly. Now, the good thing, when the donut hole went away, they put a max limit on it, right? For 2025 was $2,000, and for 2026 it'll be $2,100. Some people that have tier 3 drugs will hit that $2,100 in the first, you know, 2 or 3 months. That is pretty challenging for someone on limited income or just on Social Security, right? So one of the things that they implemented in 2025, and it'll be implemented again in 2026, is the payment. You can opt in to the payment program. And so basically what they do is they take the full cost of your drugs, and typically it's that full $2,100, and they'll divide it over the 12-month period, making it more sustainable and more affordable on a monthly basis for you to get those drugs. Make sense? All right. We have seen this year, and we'll see it again next year, many of the plans are shrinking. So some of the higher cost drugs have come off some of the plans. So just because if you're on a plan this year and your drug was covered, does not mean it'll be on your plan next year. Remember, all drug plans and all Advantage plans are annually contractual. So January 1st through December 31st, a new contract starts in January 1st. Even though you're staying on the same plan, that plan can change because it's a new year and it's a new contract. So every year, the government says October 15th through December 7th, which is right around the corner, that is your annual enrollment period. That is a time that they really encourage you. 4 different times in the Medicare New Book says it's important to take a look at it, review. You can drop, switch, or change your plan during that period of time to what it best fits your needs and wants. And all plans start on January 1st. Couple other enrollment periods that they have is January 1st to March 31st. That's called a Medicare Advantage open enrollment. So if you are on a Medicare Advantage plan, you have the opportunity to change to another Advantage plan during that period of time, and it will start in the next month, or you can go back to original Medicare and pick up a drug plan in a supplement if you so choose, all right? All right, and so again, a Medicare, you have the step therapy on drug plans, you have the prior authorizations, the quantity limits, and one of the things that, you know, I said we saw a lot of higher cost drug plans this year. When they submitted the drug plans this year, in the, around summertime, Medicare looked at all the plans on the prescription drug plans, and they sent them all back. They were so crazy priced. Medicare said it was too expensive. If Medicare says it's too expensive, it's too expensive. So they made them resubmit and recalculate what their premiums were going to be. And they really didn't give them any incentive to change anything. They just said, you need to do this. So you can expect higher premiums on our drug plans, okay? And many carriers, as I said, they're reducing a lot of their actual formularies that are on the plans, all right? So, some of the carriers out there on the drug plans and on some of the Advantage plans are, or especially the drug plans, have canceled a lot of the brokers' contracts. And that's going to be a huge disruption because statistically it says that when you have a broker that's helping you look up your drugs, helping you look up your doctors and so forth, right, making sure your drugs are on the formulary and helping guiding you in that, that's a good thing. So many of them, though, because they're in the red, and it's not their fault, it's Medicare's, right? The brokers like myself can't even enroll you. You know, I help my clients, but I can't enroll you in certain plans because Medicare, the carriers cancels our contract. So therefore, you have to go to Medicare and enroll yourself on some of these plans. So that's kind of crazy, right? But that's just where it's at. A lot of them are in the red, and so that's reality now. But I'm here to help all beneficiaries to really compare options across carriers, confirming providers and pharmacy network alignments, explaining benefits, details and coordinations and care services, supporting plan selection and enrollment process. That's what I do. I sit down with you, I look at your medications, I look at your doctors, I assess the situation, what's important to you, because what might be important to you might not be important to the person next to you, right? So it's all individualized and make sure that we're taking care of you at the best, to help you. So it's a five-step process. So we first review your current needs, your statuses, your levels, your wants, and we go over all that, asking all the questions that's pertinent to you, all right? Then we evaluate all your available options that are out there. And a lot of you always hear on the commercials, what's your zip code? Well, it goes according to where you live, right? The counties that you live in. So you have to make sure when it comes to Advantage plans and drug plans that the plan is offered in the county where you live. That's really important. If you move, you might move to a county where your plan no longer is available, and then you'll have to go into another plan. Then we confirm provider participation. So we saw a lot of things, the disruptions with doctors in 2025, and you will see some more in 2026. There are doctors out there that no longer want anything to do with Medicare or any network provider system. Have you heard of these concierge doctors and boutique doctors? Give me some money and you'll have my phone number, right? So it's a little bit crazy, but it's out there. And so then we utilize, utilizing an agent support, right? I'm here all year long. I'm not just during annual enrollment, but all year long. My clients can attest to that I do a ton of different events, and it's about building relationships. It's about getting to know you and getting to know your needs. And I love fellowship. I love building relationships. And so throughout the year, we do a lot of fun events. And it's really, I'm there to help answer questions and help guide you along that path because not only in the industry do the plans change and provider network groups change, your needs change, right? And then so I'm here all year long to help you throughout the year to answer those types of questions. And so in saying that, I did put my information out there. If you have questions, I'd be happy to answer any questions at this time. Anybody have any questions? Yes.
So you're talking about Part A, Part B, Part D, Part C.
Our Part C is the Medicare Advantage plan, so I missed that. Yeah, so Medicare Advantage plans are Part C. So you have to have your Part A and your Part B. Many of them incorporate a prescription drug plan. Some do not. They have added benefits on your Medicare Advantage plans, which is your Part C, that have, some of the dental and the vision and things like that, right? Does Medicare cover dental?
No.
Does Medicare cover vision?
No.
What about hearing?
No.
No. Does it cover your wellness, going to the gym?
No.
No. Yeah.
Well, they do cover one pair of glasses after
After cataracts.
But you can't find a doctor that will accept the plan.
Mm-hmm, right, yeah.
I've tried everywhere.
Yep, and so, so on these Advantage plans, there's added benefits, and you're seeing, sometimes in some of these Advantage plans, some of their drug formulas are a little bit richer, right? And it's all bundled together, so you're not paying, you're not having a separate drug plan, right? You can't have a separate one, so you can't have two. So it's embedded into that plan, right? And why that's important that some of these plans offer those things is they know the benefits of them. There's times where people don't want to go to the doctor, right? But if you have a toothache, are you going to the dentist? If you're seeing floaties go by, you're going to see a vision, right? Many ailments are diagnosed at the dentist and at the eye doctor, right? Glaucoma, diabetes. Many of those things are diagnosed there that you might have not caught because they don't go to the doctor, right? So they know that those are important. So when you're getting those things taken care of, you're spending less money at the doctor's office, you're staying more healthier, just like a lot of them have the wellness memberships to stay active. The more you do, the more you can do, correct? So that's really important to do that. So a lot of benefits, a lot of choices. You have your A, your B, your C, your D. That's out there. Now, a couple different things that Medicare doesn't cover. Does Medicare cover annual physicals? Wellness checkup only, right? Wellness is really to talk about your healthcare goals. Physicals are not covered, but you can see all the fraud, waste, and abuse. Many people tell me I never paid a dime for it. Well, that's because they put it in as a wellness visit, right? So you're going to see more and more of that. The costs are going to be, you're going to see those costs, and they're not cheap at all, okay? So some of the other things, does Medicare cover custodial care? I hear people all the time, well, you know, I can't feed myself, I can't bathe myself, I need someone to help me get dressed, I can't get out of bed, I can't get out of the chair. Does Medicare do that? No, Medicare does not do that. And it's important to note what I've already talked about. Medicaid did handle that. That's a long-term care support and services, correct? That you get through the state.
That's how I know about it, yeah.
Right, that is ending. Okay, so that is through MMAI, and that is ending at the end of 2025. You're gonna get it through a special dual needs plan, and in 2027, it is the only way to get that service if you're on one of those plans. So that's really important to understand that, all right? But there's a lot of other programs to give you a robust coverage, protecting what matters most, which is my motto, right? I'm not about selling. I'm the first one to run away from a salesperson. I love to educate. That's what I'm here tonight for, is to really help educate you so you can make a more informed decision. Knowledge is power, right? When do I enroll? Where do I enroll? How do I enroll? What are my options? That's what I sit down with people, and I help them to truly understand that, right? There's all kinds of different plans out there. There's long-term care, short-term care, recovery care. There are, you know, other cancer, heart attack, stroke plans. We saw an increase in those over the last couple of years, right? There's dental, vision, standalone plans that help supplement some of these plans. So there's a lot of other benefits out there that are important for you to take. Hospital indemnity plans, the increased cost of these plans when you go into the hospital, right? Maybe you need to travel, going to the Mayo Clinic or the Cleveland Clinic, right? All of that's an expense. So going in the hospital, they pay you out, you know, per day while you're inpatient hospital care. All that would come in handy if you need those services. So it's about having a robust plan of protection to help you in that time of need, because many people do not think of those services until we're in the midst of it. And if you ever took care of a loved one, you know the importance of having those types of plans, right? We're going to do it because we love them. But if you had the types of plans that will help cover those, that would be better, not only for you, but also for your loved one, right? Yes?
Does each pharmacy negotiate the cost of their scripts with the individual companies? That's why you have to choose a pharmacy?
So the companies negotiate the contracts. So not every pharmacy there's standard pharmacies and there's preferred pharmacies. So not every pharmacy will be contracted with a certain plan. So that's why you want to make sure.
Which pharmacy, so I'm registered with CVS, but there's sometimes CVS doesn't have that prescription. They might not get it for 2 weeks.
Mhm.
So if I go to Walgreens with it or somewhere else, I'd be paying more?
Sometimes. Yep. Not always, but sometimes. Hi. Yeah, so they're not all contracted with every single, just like every drug is not on every plan, right? Just like every doctor and every network provider group is on every plan. That's why it's important to do your reviews. Look to see who your doctors are, look to see who your medications are, and make sure that the plan is the right plan for you. Every year, do a review. Yeah.
So if your doctor, if the plan goes out of existence, do you get a letter from, cause you said check the formulary, but you're not gonna know the formulary, but do they say, okay, this drug will no longer be,
Yeah, you do. You get a letter. Usually that happens during, you'll get to know that during annual enrollment. The only time throughout the year is if the manufacturer, if they find like that drug is no longer good for you, right? That's usually typically throughout the year when that drug would no longer be available, or there's a shortage. We saw some of that this last year. But typically, we know by October 10th what drugs will be on the formularies for the following year. It's usually set in stone. Most people right now are getting what's called their annual notice of change, right? The ANOCs. And so you can take a look, anybody who's on a particular plan, what is it this year, what is projected to be next year, right? But some things can change a little bit all the way up to, October 5th, October 10th. So, yeah. But that's what I do. I sit down with all my clients and I give them a review. We look at what their options are and help guide them in that process. Okay? Hi.
Hi, I have a question.
Yes.
Want to know if I'm in the right place. Is for the condo association meeting?
No,
It will
ma'am.
be after this,
I don't know.
and then, oh, okay.
I have no idea. Uh-huh. Yes.
This is the reason.
No, you're fine. Did somebody raise their hand back there? Yes.
So on the supplemental Medicare piece, right, that's,
The Medigap, is that what you're saying?
yes, supplemental, it's Part G, Part
Yep,
N.
yep.
Do those cover the dental, the ear,
They do not, because a Medigap plan only covers your out-of-pocket expense of what original Medicare covers. So and I hear this all the time, right? Well, Medicare didn't cover it, but I have my supplements. If Medicare does not approve it, your supplement is not approving it either. Medicare is the insurance, the supplement is your out-of-pocket coverage, all right? It's helped to cover your out-of-pocket expense. Medicare is who approves it, does the prior authorizations, and will pay that 80%, leaving that 20% for your supplement or your pocket. Mm-hmm. Yeah.
so I looked at some of the, premiums for some of the Medigap programs.
Sure.
It almost seems as if you're not taking a lot of medication, it might not even be worth it. Or if you're taking low-cost medication. Because Medigap is kind of expensive from what I can see.
So two different things you're talking about, because you're talking about drugs, but you're talking about Medigap, right? So Medigap is not to deal with your drugs.
You're right, I'm sorry, you're right. It's only for the 20%. What is for the copay?
It's for your deductibles and copays, your out-of-pocket expense, correct? So all your Part A costs and that 20%, because there's no cap on Medicare, on Part B, right? There's no cap. So that's what's filling the gap. That's why it's called Medigap or Medicare Supplement, is helping cover your out-of-pocket expense. And because of all the increase of the Part B biosimilar drugs and testing and so forth and everything that I've already discussed, we saw double-digit increases. We saw from 16 to 40% increases. You're going to see that disruption over the next couple years. More and more people, they can't, and we saw drug plans at double digits, right? There's been a lot of people that can't afford that, so they're reverting to the Medicare Advantage plans, which you have adverse people that were on these supplements now going to Advantage plans. There is no underwriting on Advantage plans whatsoever. So they're able to go on Advantage plans, right?
I think I meant to say, if you don't have a lot of doctor's appointments, if you don't go to the doctor too advantageous to get the Medigap? I guess you gotta,
Every person is individual. You all have your own reasons on what kind of healthcare you want, right? Do you travel? You know, do you have a variety of doctors in different networks, right? So there's a lot of reasons. Are you a snowbird? So there's HMOs and PPOs on the Advantage plans. And HMO is a health maintenance organization where it's a much more coordination of care. You must stay in the network. Many of them you need referrals, not all. But it's a much more coordination of care, a lot lower costs, right? But a lot more rules, right? Where on a PPO on Advantage plan, it's a preferred provider organization. You have a variety of options and network provider groups to pick from. There's no referral process, but you have flexibility, freedom of choice, right? In network and out of network. You're gonna have lower costs in network, and you have a lot more cost out of network. Makes sense? So everybody's different. As I said, I have people come sit in my office that one spouse will want one thing and the other spouse will have something totally different. More and more people, though, I've noticed, have been going on the Advantage plans because of the increasing cost. There's over 54% of people on Advantage plans nowadays and projected to be at least 60% by the end of the decade. So we're seeing more and more of that because of the rising costs. Yeah.
One other thing, you mentioned snowbirds. Do you compare, or do you take the plan from the state that you spend the most time in? Or can you
So
do either one?
it's the state of residency, okay? So it's 6 months in a day where you live. Where is your address parked? Where does Social Security, where do you have your information with Social Security at? Usually it's 6 months in a day is your legal home. The other one is your vacation home, right? So I have snowbirds that go 3, 4, 5 months, really close to that 6 months, but not 6 months in a day. Because technically then that would be their residence, right? So it's, we look at the plans that are where their residences.
If you become ill, only because I'm considering moving, or being the snowbird, what if you get ill in the other state that you're in for 3 months? Can you go anywhere?
Great question. Depends on the plan you're on, right? So on all the Advantage plans, emergency and urgent care, you're in network anywhere in the country, right? So it doesn't matter. But if you're there for an extended period of time, right? Because people who travel throughout the country, they technically are not going to go to the doctor. You know, something happens, yes, you're going for your emergency, your urgent care, and you're covered in network, just as if you were at home. But my clients who are snowbirds, and they're there for an extended 2, 3, 4, 5 months, so they go on plans that they know that they have a network down there as well. There's several plans on the market that have national networks. So they have doctors here and they have doctors down there. They have dentists here, they have dentists down there. So that they get in their care in both places because they have an extended period of time in both places. Absolutely. Yep. Great questions, guys. I love it. Anybody else? Yes. The G plan? It's a supplement, a Medigap plan. So it helps cover all your Part A deductibles and your co-insurance, helps cover the 20% after you reach your deductible, right? In 2025, that deductible is $257. The numbers are not out for 2026 yet, all right?
oh, it kicks in after the deductible is met, huh?
So it's 20%. You have to, so Medicare pays first,
Yeah,
right?
yeah.
At the 80%, leaving you the 20%. So you're gonna pay the full cost of your bill.
Up to 257.
Once you reach your deductible, whatever that will be for that year, because it changes every year with inflation, right?
Yeah,
Then your Medigap, your supplement will cover the 20%.
okay,
Make sense?
yeah.
Did I answer your question? Okay. So we made it in an hour, guys. So thank you. So as I said, Medicare is very strict, right? When it comes to someone like myself calling you, setting appointments with you, Medicare wants to make sure that it's not fraudulent, that you're giving me permission to talk to you about all your different options. Even though you make the appointment, you're coming to my office, you still have to, this is what's called a scope of appointment, and this is what's called a business reply card. In order for me to call you back, I need a business reply card saying that you're giving me permission to call you. so that we can set up appointments, so we can take a look at it. And it doesn't matter if you're not ready to retire. It doesn't matter if you're not turning 65 in the next month or so. I sometimes have clients, I do these seminars all the time. I have people come out that aren't going to retire for 3 years. But we put them in the database and we stay in contact with them. We put them on the mailing list and they get a lot of my mailers, right? And then when they're ready, 3 months or 2 months prior to their retirement, they call me, or I give the permission to call them and help them in that process. And then this here is what's called a scope of appointment. There's several boxes at the top, and in order to stay in compliance, Medicare says you have to check all the boxes that you would like to discuss. I ask my clients, check all the boxes. This way I stay in compliance, because guess what? You deserve to know all the knowledge, right? To have all the knowledge. And I really go after helping you to understand all of your options. So if you check all the boxes, I'm able to help you in that process to see what plans might be in your best interest according to your needs and wants. Yes?
How can you I get 5 to 7 calls a day about.
I know. So.
They do that.
So and you know this, right? You're my client. So I tell my clients, put my phone number in there, put your loved ones in there, put your doctors in there. Do not answer the phone otherwise, right? There are so many, Mayor Glass have done things on there, the chief of police have done different meetings on there. I've done stuff with the meetings up at the SALT program, the seniors and law enforcement in Tinley Park. There are so many scams out there, guys. If someone calls you and they say, is your name Joe? And you say yes. Guess what? They're taping that, right? And you just bought something you didn't want to buy. So you got to be really, really careful, right? So if you don't know that number, let it go to voicemail. You all have voicemail. Listen to it. If it's garbage, it's garbage. Delete, right? I one time, no joke, I was sitting at a client's house. The husband and wife were sitting across from me, and the husband's phone rang, and it was her phone number, and her phone was sitting right there. They're able to link into your guys' phones, right? It's a scam. So be very careful and know who you're talking to. Never give your Medicare number out to anybody over the phone. Never give your information to anybody over the phone, all right? Because before you'll know it, they'll own you. They'll own your bank accounts and your house and everything else, right? I've heard some crazy stories out there of people getting scammed. So just be very, very careful. Let me end with this. There's a lot of programs out there as well. So because of all the rising costs and that Inflation Reduction Act that was instilled in 2022, there was a lot of things throughout it. Vaccines were set at a certain price at $35, or not vaccines, I'm sorry, insulins. Many vaccines were at no cost. The poverty level to get what's called LIS, low income subsidy, extra help is the program. Used to be only up to 135% above poverty people were eligible for it. They raised it to 150%, allowing more people to have access to that. So I hear people all the time say, oh, I'll never qualify. I'm like, make the phone call. See if you qualify. It will lower the cost of your prescription drugs, maybe your deductibles and so forth. So definitely look into there. There's a lot of programs on the government site that will help you through Medicare.gov or SSA.gov. A lot of programs out there that can help you in different grants and so forth. So through the Catholic Charities and many that can help you with that program. So that's the one thing I do love about the Advantage plans. On the Advantage plans, there's a lot of programs that go above and beyond what original Medicare. I have clients that had some great benefits from use of that that they would have never gotten on original Medicare. So as I said, each person is individualized. It's what's best fits your needs and wants, okay? Thank you all. Thank you so much for coming in. I hope to see all you, hear from you, and I'm here for you. Thank you.